Sure, I'm the head athletic trainer at the University of Illinois at Chicago. Uh, I am in charge of all 18 intercollegiate sports at UIC as far as their care and prevention of athletic injuries. I'm in charge of a staff of 4 people, assistants that help me take care of those student athletes, take care of all the administrative duties, and just make sure the health and well-being and safety of all of our student athletes is taken care of.
What is your professional background?
Professionally, I started out in 1984 as the head trainer of a Division III college, Elmhurst College, in the western suburbs of Chicago. I was there for 7 years. Then I was an assistant athletic trainer at Northwestern University for 6 years, and now here at UIC for the past 10.
At UIC, can you mention the sports that you work with?
Sure, like I said, I'm in charge of all 18 intercollegiate sports, so I oversee all of them. The ones I'm directly related with is men's basketball. Actually, when I was hired, that's what I was told that I was to really pay the most attention to. And believe me, I pay attention to all of them, and I try to go to most of the events that I can. When kids come in, I see, it doesn't matter what sport they are, but I travel. The team I travel with and spend the majority of time with is men's basketball.
What is the most common injury that you see with the men's basketball team?
You know what, it depends what year it is. There's always overuse stuff, which really is a catch-all phrase for a lot of different things, strains and sprains and just overuse injuries, shin splints, things like that. If you want to break it down or just ask about the number one injury, it's probably a sprained ankle, although we do everything we can to prevent that. It's required here and at most big schools that you either get taped or braced for your ankles before you go out on the court. You have to do one or the other, so we make sure that happens. If you've had a history of injuries, if you've had a recent injury, we make sure we tape you. If you have never had a history of anything, we make sure that you wear ankle braces. Again, to try to prevent injury, or if it's a devastating ankle injury, it may lessen the time you're out. Because really, an ankle sprain, I mean, a bad one can take up to 6 weeks to heal. And in a short college basketball season, that can be a good chunk of your time.
What do you do as far as training, strength training, to prevent ankle injuries?
The big thing is proprioception. We're very fortunate in that we have a tremendous strength and conditioning component to our athletic department. We've got 2 strength and conditioning coaches that help us out, and really, and you can talk to them about it, it is their main job not to get people strong necessarily, but to prevent injury. But we do a lot of things too. Let's take ankle injuries. We do a lot of proprioceptive work, and that's a lot of balance, balance board, balance beam, things to make them check their balance without even thinking about it. So when they're on the court and they're in the air and get bumped and come down awkwardly, they can adjust without really thinking about it. So that's the big thing.
After an athlete is injured, what are the methods that you will utilize to make sure that the athlete is back in the court as soon as possible?
That's a good question, and there's a lot of answers to that. Number one, of course, is our evaluation. We take a look at the injury, ask a bunch of questions, find out everything we possibly can how that injury happened, and what they felt like. Then we go from there. If they need a referral on, maybe for x-rays, MRIs, whatever, our team physician would go ahead and facilitate that. If not, if we think we can handle it, then we just start treatment and then rehabilitation as soon as possible. It's not, the athletic situation is not like a normal therapy, physical therapy place or a doctor's office at all. These kids want to get back on the court or on the field as soon as possible, so we try to help facilitate that. And what we do is, like I said, we'll start treatment. We'll start the stims, the ice baths, the heat, the ultrasound, whatever we need, as well as soon as possible, Number one component is to get swelling out. When we can do that, we can start motion and we can start functional stuff. And we try to get them back as quick as we can and safely as we can. We're certainly not going to put anybody out there that isn't ready. And the coaches understand that, and they give us a lot of leeway to let us do what we need to do. But from evaluation to treatment to rehabilitation, that's what we do. We take care of everything in the training room, and that's basically how we get it done. If there's a hitch in that sequence at all, we make sure that we follow up with our team doctors, with specialists if we need to, at all times letting the coaches know the status of those injuries and when they can expect that student athlete back.
How do you reduce swelling?
The number one way to reduce swelling is ice compression and elevation, ICE. That's been taught to everyone since we were, knee high. Something happens, swelling occurs, ice will slow down blood flow. Most of the time, swelling is bleeding into an area. Well, if you put ice on it, it slows blood flow down and it keeps swelling from happening. It also helps reduce swelling. Compression, by putting a compression wrap around with an ace bandage, something like that, it helps force the swelling out and get absorbed into other tissue and go away. And elevation, of course, say it's an ankle, like we talked about before, you elevate the ankle, gravity won't pull swelling down into the ankle. So with those three things, we try to control swelling. In our case, we're lucky enough, fortunate enough to have a compression unit as well. Most schools do. So we'll put, say it's an ankle or a knee injury, a lower extremity injury, we'll put a compression boot on, and intermittent compression happens, and that also pumps swelling out. But again, swelling is the most important part of beginning the rehab process, in that we need to get the swelling out of an area in order to start rehabilitation. Because if it's so swollen that you can't move it, it's hard to get strength back, it's hard to get range of motion back, it's hard to get any function back. So that is the number one thing we do when we start treatment and rehab.